a lot of those early GLP-1 agonists, which were things like Trulicity, Ozempic, Wegovy, now Mounjaro, have now been FDA approved in recent years for the indication of obesity. So 10 years ago, we started using them for diabetes. And so those indications, we used them, they're very effective, and we noticed the side effect of weight loss. And so obesity is something that is very difficult to treat. It's multifactorial. You have metabolic, hormonal, genetic, lifestyle, all play a role in obesity, which makes it very hard to treat. And so having a medication that boasts at 6 months, you should be losing 5 to 10% of your weight has been really positive.
So these medications are meant to work at our GLP-1 receptors in the body. GLP-1 is a hormone that all of our bodies make that naturally is responsible for insulin production, working at the pancreas. It also helps to, again, regulate appetite. So when our body knows that we're eating something, it more appropriately produces the dopamine signals that allow our brain to know really that we're getting full. And then GLP-1 receptor agonists can also slow down how quickly the stomach empties food or digests food into the small intestine. And so from this mechanism, patients will typically say that they feel fuller faster when they're taking one of these GLP-1 receptor agonists for weight loss.
One thing doctors will talk to you about when they're starting the medicine is it comes with changing lifestyle as well. So trying to add in 150 minutes of cardiovascular exercise in your week, that will increase your metabolism, so make it easier for you to keep the weight off, and then becoming aware of the amount of calories that you take in. And so the data is, if you come off it, most patients will regain some of that weight. Somewhere between 14 and up to over half of that weight can come back after you stop the medication. So because of that, there's the recommendation that you stay on it permanently after you've started it.
The patients that are most successful in avoiding a significant amount of weight regain are those that have made other lifestyle changes. And in addition, they've also noticed positive effects for some of their other disease states. So in a patient who has hypertension or high blood pressure, if they've noticed that their blood pressure has improved, then they're more likely to put in the work to maintain that blood pressure the way it is. With the medications that we have on the market, all of these are injectables. So we have 2 drugs, tirzepatide and semaglutide, that are injected once a week. And then we have 1 drug, liraglutide, that is injected once a day. All these injections are given in the subcutaneous or the fatty tissue. So the best place to access that fatty tissue, where we get the best absorption or use of the medication, is typically in the stomach area.
Obesity is related to a lot of health conditions. So, you can have, increased heart attacks, increased strokes, increased cancer. So, things that can kill you. And then other conditions like high blood pressure, diabetes, high cholesterol, even joint pain. And all of those, you can have significant improvements, reduction in heart attacks, strokes, cancer, improvements in those other diagnoses with even a 5 to 10% weight loss. It's given us another tool in our tool belt to treat a very difficult condition of obesity.